Welcome everybody to the breakout session. Please remember to click on the expo to visit our sponsors or the Learning Lab for hands-on presentations. And at this time, I'd like to introduce Camila Arizaga, MSW, talking to all newly diagnosed patients with ALS 101.
All right, should we give it a minute or so, Melissa?
Let's see. Go ahead and get going. It looks like we've got a game on here, and I'll stay on to help if needed.
Okay, just let me know when it's a good time to start, and I just want to make sure that everyone joins.
Perfect. All right, let's go ahead and start.
Oh, okay. All right, I want to make sure that you're all seeing my presentation, my floating face. So I'm gonna go ahead and get started. My name is Camila Arizaga. I'm a social worker, and I'm very, very excited to be part of the 7th annual symposium and have the opportunity to share with you this information. I'm a former program manager for the ALS Association Florida chapter. I was in Miami-Dade County. Well, I'm currently in Miami, and I'm still involved with the mission to discover treatments and a cure for ALS, and to serve, advocate, and empower people affected by ALS. So I'm really happy to be here today and answer any questions that you may have. This is really an overview, and I'm just super thrilled. So thank you everyone for joining. And as I say, some people saying hi everyone. Oh, you have an echo. I have an echo. Well, let me know if you still hear that echo. Otherwise, I will proceed. I hope you can hear me fine. So I'm on to the next slide. I hope that you can all see the next slide. So what to do, where to begin. This is what I call the ALS one-on-one presentation. It's a moment to take charge, to be practical, to prepare and adapt, all right? And, it's sometimes hard to receive this type of diagnosis, and for sometimes I say most parts, right? There's really no easy way to hear you have ALS. But let me tell you that approximately 15 Americans hear those words every day. And if you sign up for this presentation today, chances are that you or a loved one has been recently diagnosed. And, some, if not all of you, have thought or, thought of some of these things that I put in this bubble. I've added to the slide things that have probably crossed your mind, right? So I'm gonna leave this. Oh, I hear it. Sounds good to me. Okay, I'm just making sure that everyone can hear me properly. So yes, I added to the slide things that probably crossed your mind when you or your loved one received the diagnosis, right? What resources are out there? What's the first step that I should make in terms of medical care, treatment? Is my house safe? Research, what research out there, what's going on, what advances there are in terms of treatment, government benefits, that's a huge one, insurance, legal advice. So, if this has come to your mind, know that you're not alone. However, everyone responds differently, and there's really no one right way to feel. You have to allow yourself time to work through whatever emotional reactions you may be experiencing, but definitely know that you're not alone. And I'm here today to educate you and empower you to take charge. And, hopefully this information will be very useful for you. I'm going to be touching on these topics that are in this little bubble. However, I do want to point out that the information that I'm going to be providing today will be summarized. And the objective is really for me to give you a starting point. It's going to be like an overall guideline to navigate the disease and be a step ahead. That's really important, right? To be a step ahead. Now, you can see it almost like a checklist and things to keep in mind. I do want to let you know that there will be time for questions and answers at the end. We're all living in this virtual world today, so I'm going to do my best to look at the chat box, go through the information, make sure that I cover everything, and that we have some time to chat afterwards and sort of like an open forum format. But right now it's a little bit tricky to navigate questions as I go, so we're going to leave those towards the end. Okay, I'm going to move into the next slide. I'm going to give it a second because sometimes there's a little bit of a delay. So I want to talk about multidisciplinary care. Incredibly important. Multidisciplinary clinics bring together a team of medical professionals that are specially trained to meet the needs of those living with ALS. And it really allows the patient to receive care from each discipline during a single visit. Studies actually show that multidisciplinary care really confers a survival advantage for patients with ALS. So you can be part of this multiple decision-making process within a multidisciplinary setting. And really the clinical outcome, it's better. And this has been shown in studies. So that's why I'm highlighting the importance of, multidisciplinary clinics. And know that, the clinic team will help you navigate the disease, answer any questions, make sure that you receive the best quality of care, but also remember that you are in charge throughout your illness. So don't be shy about asking questions or communicating your preference when you do go to these appointments, okay? So the multidisciplinary team typically includes a neurologist, a physical therapist, an occupational therapist, a respiratory therapist, a nurse, a registered dietitian, psychologist or psychiatrist, a speech-language pathologist, a social worker, and an ALS Association chapter liaison. So it's a big team of people. Could you imagine going on different appointments on different days, like one day to see the respiratory therapist, next day to go see a dietitian? It can be a lot. So really the benefit of having the whole team in one place at a given time and them working together with each other, it's going to be incredibly beneficial for you as a patient and, for your loved ones as well, because it's very practical and efficient with time and whatnot. So, definitely keep that in mind. Now, I do want to point out that the ALS Association is the certifying body of these ALS centers. And I'm going to give you a visual of where these centers are. I'm going to give it a second. Okay, so I'm a very visual person, so I put together this little map, just pinpointing where you can have access to this multidisciplinary care that we're talking about, right? So the little dots in red are actually the centers of excellence in the state of Florida. We currently have 5 centers of excellence in the state of Florida, the Mayo Clinic in Jacksonville, and we also have UF Health Jacksonville. There's the University of Miami, the University of South Florida as well, and Holy Cross ALS Center in Fort Lauderdale. Now, we also have 4 centers that are affiliated clinics that are Lee Health in Fort Myers. We have Orlando Health, Sarasota Memorial Healthcare System, and UF Gainesville. It's incredible that in the state of Florida, we have 9 centers where we can access this type of care. That's crucial. 2 years ago, there were 5 centers overall, including affiliated clinics and centers of excellence. And, fast forward 2 years, we have 9. So, it's great that this is more accessible for everyone. And I guess the map, it's probably a good visual to see where's the closest one to you. And I do want to point out that the 9 centers offer the same high quality approach to multidisciplinary care, all right? The difference between the affiliated clinics and the ones that are called centers of excellence is that the centers of excellence offer on-site research opportunities to participate in clinical trials. So that's the main difference between the centers. But like I said, and I do want to highlight this, it's the same high quality approach, and you will find fantastic teams all around, okay? So really, really good information right there. I'm going to move on to the next slide. And I want to talk a little bit about the National ALS Registry. The National ALS Registry is a congressionally mandated registry for persons in the US with ALS. This doesn't mean that's mandatory for you to sign up, but I do want to encourage you to do so because it's incredibly beneficial for yourself in the long run, but also for people that are looking for opportunities to do research. The ALS National Registry looks for common grounds and really creates a foundation for research. Okay, so it is the only population-based registry in the US that collects information to help scientists learn more about who gets ALS and its causes, and it's really looking at the why. Like when I said common grounds, everyone has a story or a hypothesis of how they think or when they think they contracted this disease or what happened. Some people it's an accident, some people it's after being exposed to a certain something, and they want to know your story and put all of these stories together and really find what's going on. So really completing these brief risk factor surveys can help scientists defeat ALS. So if you haven't done so, I really encourage you to do that. Join the registry. There's a couple of buttons that you have to click, really easy, and you can allot 40 minutes for the survey. It can be a little, lengthy, but definitely worth it. And I cannot highlight this enough. The information collected from the surveys could possibly help persons with ALS in the future by allowing healthcare providers, researchers, and other interest groups better understand who gets ALS, okay? So I do want to leave that information for you. You can take notes. I'm going to be adding some links to the chat box afterwards so that you don't have to take notes of those links. And we're all on the same page. So moving on, I spoke a little bit about research in that previous slide about the ALS National Registry. For me, and this is just like my personal opinion, research is super, super, super crucial and important. And like I said, we have 5 centers of excellence here in Florida that are conducting on-site research. Now you may be thinking, what do I get from research? What benefits? What does it entail? So I sort of want to really quickly go through what does this mean and what possible outcomes or benefits you could have. Again, this is a possibility. So you may have access to promising new medications and interventions before they become widely available. You may receive research-related care or medicine at no cost. You may be able to make a more active role in your personal healthcare decisions. So usually people that are enrolled in research, they have a close connection and contact with the people that are conducting the research, and as an outcome, they're more active, okay? Your health may improve if the study therapy proves to be effective. And even if you don't directly benefit from the results, and this is huge, you may not directly benefit from the result of the clinical trial you're taking part of, but the information gathered can help others and add to scientific knowledge. All right, so it's really being part of something bigger, of helping out the collective, right, to move forward. And definitely clinical trials are vital to the process of improving medical care. Okay, and along those lines, continuing with research, I want to touch base a little bit on clinical trials. I listed a bunch of them in this slide. I'm not going to go over them. It's just to give you an understanding and an idea that these are some of the trials that are happening in the state of Florida. They're active. I mean, some of them might be postponed due to the pandemic, so I do encourage you to double check that. But it's really to point out how proactive you could be, and that this is happening here in the state. It's fantastic. It's really, really important. You as a patient may not be eligible for all of them, maybe for some of them. And even if you're not eligible, I encourage you to take a look and see what's going on, like what advances you're making. ALS, as you may know, it's a complex disease. Some may even consider it as a various diseases in one. So it's really fascinating to take a look at these clinical trials and see what's going on. Now, I do want to bring some attention at the bottom of the slides. There's 4 links, websites that I put there. We have really great resources that I want to share with you. And like I said, I'm going to be adding these links to the chat box for you to later review. So we have clinicaltrials.gov, which is basically a library. It's a database of privately and publicly funded clinical studies conducted around the world. So it's really a good place for you, for those of you who enjoy to read a peer-reviewed article and get that scientific knowledge. It's really a good place to go and research that. Great database. I cannot highlight that enough. We also have NEALS, which is the Northeast ALS Consortium, and they basically want to rapidly translate scientific advances into clinical research and see what new treatments may be available for people with ALS. And you can go in there, you can search for trials, you can see what's happening nationwide, what's active, if you can even determine your eligibility for some of them. So if this is something that you're interested in, definitely take notes of these websites. Then we also have Patients Like Me. It's more like a forum. I believe there's over 13,000 ALS patients registered in Patients Like Me who are comparing treatments, tracking symptoms, and getting advice from each other. So there's not like a medical professional behind it. It's more people that are in your same situation sharing their experience. So you can sort of get that advice, share what you're experiencing, and it's really from others who understand ALS from your same perspective. They're in your shoes. So there's that resource as well. And then, of course, we have ALS Untangled that you probably know by now, which is the website created and curated by Dr. Richard Betlach, who just presented, the neurologist at Duke University, for those who missed it. And it really aims to bring a scientific approach and review those quote-unquote off-label alternative ALS treatments. So great resources for all of you to have handy, right? Moving on. Speaking of resources, I do want to touch base on the resources that the ALS Association provides. They are fantastic. I mean, by now, maybe most of you have gone to the ALS Florida chapter website. If not, it's right at the bottom of the screen, and sort of played around with it, see what's there, what resources you can get. We have amazing webinars that are pre-recorded by topic. If you find a topic that's relevant to you, and you want to do more research about it, it's a great source of information. We also have resource guides, which are 11 manuals almost that address many of the common concerns and issues that face people living with ALS, such as speaking difficulties, nutrition, mobility, respiratory issues. So what I love about those manuals or resource guides is that they are divided by topic, right? So one, it's only nutrition, the other one's only mobility. And that way you don't get overwhelmed getting all this information at once, but you can really start by what's relevant to you as an individual, because it's such a unique disease from person to person. So I always tell people, when I was working with ALS patients for 4 years, never compare yourself to the person that's right next to you, because you may never experience some of the things that they are experiencing. So these resource guides are very friendly and they're a great source of information. Definitely prefer that over Google. That sometimes can be a dark place. And then there's the medical information packets and support groups. Support groups are huge, and we've all reinvented ourselves throughout the past 6 months or 7. The ALS Association has 17 groups total right now, which is amazing. And I believe 14 of them are virtual and 3 are over the telephone. So they're pretty accessible. They're trying their best to bring that same support that they were having in the in-person groups virtually, and it's been very successful. And the beauty of this group is you really get to build a network of support, which is crucial. And don't get me wrong, it's not the type of group where you just go and talk about your feelings. Some people think that, or I guess that's a connotation when you say a support group, but they're very educational. Most of the groups have a topic each month, and they really go in depth into that topic, be it hurricane preparedness, or be it durable medical equipment or mobility. So they're amazing because you do get that educational aspect, but you also get to build relationships. So it's huge. It's huge. It really provides an opportunity to meet and connect with other families that are in similar situations and share resources and really learn from each other's challenges. And again, there's always forums, blogs, groups, and social media that could be helpful for you. And again, we do realize that COVID-19 has created a new normal for all of us, and it's great that all of these resources are available to you in a virtual way. So definitely, take advantage of that. On to the next slide. Be proactive. If you're proactive, you're really focusing on preparing, and that way you're staying away of being reactive, where you usually end up focusing on repairing. And preparing means preparing for the possibilities. That's a key word, possibilities. Like I said, ALS is very different from person to person. So you don't want to be ahead of the curve, but you don't want to live in the future and worry about things that may not even happen, right? So basically what I'm trying to say is have your toolbox handy. Being in this presentation, I'm going to provide you with a lot of tools. So it's just like keeping that hurricane bag next to your door just in case, and maybe we don't get hit by a big hurricane in years, but it's there. And ultimately that will give you some peace of mind, all right? I'm going to briefly cover some of the benefits and some ways you can be proactive. Most of the things vary from person to person. They're very individual, but it's just for you to keep in mind, okay? So you can start having these conversations with the appropriate people, okay? So huge one, Social Security disability. If you're under the age of 65 and you have paid into the Social Security system, you can apply the day you stop working or when your work hours decrease. Now, with Medicare, this is something, it's a huge accomplishment from years of advocacy. So now when the Social Security disability goes into effect, patients are automatically enrolled in Medicare. All right, keep that in mind. There is not a 2-year waiting period for Medicare for patients with ALS. Huge, very important, taking advantage of that Medicare. If you're eligible, you definitely want to take advantage of it. Employer's disability and retirement benefits. You want to gather information from your employer, consult with a financial advisor if needed. With taxes, you can contact your local property tax appraiser office about property tax exemptions for persons with disability. Huge one. You could be eligible eventually if you're not already. You can request prescriptions from your physician for sales tax exemptions and items that you need due to your disability that are not covered by insurance. This is for you to keep in mind. Like I said, it's going to vary. This is going to be very case by case, but I do want to sort of plant that seed so that you know to have these conversations down the road. Very important, like I said, to prepare. Okay. Now onto health insurance. Again, very personal, very case by case. Review your health insurance coverage to understand what care and equipment is covered and what not. You can also ask the social worker from your clinic. So if you're already attending a multidisciplinary clinic, even if it's a virtual visit, if it's telehealth, you want to ask that question. If there's a social worker available, start reviewing this information with him or with her, okay? If you have private insurance or are enrolled in a Medicare HMO, request an insurance case manager. These are resources available to you. You gotta take advantage of them. Find out when open enrollment is if you wish to change your Medicare and or supplemental policy. Huge one for everyone. And I think it's open enrollment now for a lot of private insurance companies. And another incredible resource, it's Shine. So what is Shine? It's a free program offered by the Florida Department of Elder Affairs and your local area agency on aging, where specially trained volunteers can assist you with your Medicare, Medicaid, and health insurance questions by providing one-on-one counseling and information. So it's an amazing resource for you from the state of Florida. It's free, it's confidential, and they can help you navigate through this crazy, tricky insurance world. And especially if you're having a lot of changes with insurance, or you're recently enrolled in Medicare, and you have questions, take advantage of this. And just as a basic suggestion, type of rule of thumb, it's keeping Medicare as your primary, and any other, be it Humana, Blue Cross Blue Shield, United Healthcare, whatever it may be, as a supplemental, okay? So that's just like a basic suggestion. And again, you can always bring this up to your social worker in your multidisciplinary clinic team. They're gonna be happy to assist you. So, important documents. It's not always easy to have these conversations, but they're really a necessity. It's very useful, and not just for you folks, for everyone, like for the world, for everyone. It's important to have these conversations, as tough as they may be, because sometimes in our narrative, we all have a personal narrative. We never think of, getting a certain diagnosis or having to go through certain experiences, but it's the only certain thing in life. So we need to make the best out of it, and we need to make sure that we're prepared. So if you have to consult with an elder law attorney to make certain that your property will, your living will, healthcare surrogate, and other important documents are addressed or are in place, it's super important. If you have to designate a power of attorney, again, something you can discuss as well with your social worker at your clinic. Discuss and decide if you want to have a DNR, do not resuscitate form, active. Important. It's important to discuss it also with your family. Include your family members, include your loved ones. You can consider ALS-specific advance directives. For those who don't know, an advance directive is a form that you fill out to describe the kinds of medical care you want to have if something happens to you and you cannot speak for yourself. And it really tells your family and your doctor what to do so that they don't have to decide for you. So I have my advance directives in place. When I told my mom, listen, Mom, I want to give you a copy of my advance directives, she freaked out. She's like, why are you thinking about that? Like, what do you mean? It's important because I don't want them to have to make that very, complicated and serious decision for me, because it's going to add a lot of stress to their lives, and I don't want that. I'm an only child. I want my parents to know what I want and for them to have it in writing, and then they're not going to be in that difficult position of having to guess what kind of treatment I want or I don't want. So super important. And there's also the 5 wishes. Completing the 5 wishes is just another way to write your advance directive. And like I said, these documents are important for everyone. Don't think it's because you have an ALS diagnosis. It's really a conversation that we all need to have, because it really keeps your family, friends out of that very hard position of having to guess, what's the best for him, what's the best for her, what do they want or what they don't want. So yes, there's some tough conversations, but they're very needed. And I think as a society, we need sort of to normalize the importance of having these documents in place. And it's just part of life, and we need to have a positive attitude toward these documents as well, because they're important. And I mentioned the word attitude, and it's not the first time that I'm going to mention it. There's this quote that I like that it says, your attitude, not your aptitude, determines your altitude. Huge, right? This speaks volumes. So your attitude, not your aptitude, determines your altitude. I'm just going to leave that quote there for you. Some of you may stop working soon, or working less, or have less hours, and you're going to have more times in your hand. And you have to look at the silver lining of having that extra time in your hands and start doing what's important to you, whether it's writing a book, whether it's taking a virtual cooking class, because we now live in a virtual world, or just spending time with the people that you love. So do that. Do what's important to you. Keeping yourself active, right? Very important. Finding fulfillment. And including your friends and family members. Sometimes we assume that when we're in a tough situation, if we want to look at it as tough, because it's all about perspective, we're like, oh, I don't really want to involve my friends. I don't really want to involve my family. It's good. I don't want to feel like a burden or whatever it could be. But they want to be part. They want to offer you support. I can assure you that. So huge. And I want to share with you, and granted, this was prior to COVID-19. These are some actual items that patients I work with had in their bucket list. And I want to encourage you to come up with your own bucket lists because they're important, right? If you do have that extra free time, what are you going to do with it? And again, you may not be going on a cruise anytime soon. I'm probably not going to go on a cruise anytime soon, or a Cirque du Soleil show. And again, this was like some actual bucket list items that I'm sharing with you. And it's just to give you an idea. Is it learn a new language? Is it ride a hot air balloon? Solve a Rubik's Cube? I've never been able to do that. I'm still trying. Okay, plant a tree. Have a professional family photo shoot. Go apple picking. Foster dogs. And these are my two favorite. One, try all the cheesecakes at the Cheesecake Factory. Sounds good to me, right? This is up to each person. You have to sort of dig deep in what is it that you want? What's going to make you happy? What are you going to do with your free time? And the best one that really just cracks me up, it's actually do the things on my bucket list. I've had a bucket list since I was like 10 years old, and I keep adding to it. And I think I cross one item every 5 years. So again, I'm just giving you an idea. I just wanted to share this with you because it could inspire some of you to start exploring new things, right? So I'm gonna move on. And I'm gonna take a little pause right now because sometimes I feel like I talk so fast. I want to make sure that you're actually, noting down these things. Like I said, I'm gonna be sharing those links on the chat box for you to have. But yes, just so that you can digest what I'm saying. Veterans benefits, important. Veterans, as some of you may know, are twice as likely as the general population to get ALS. If you're a veteran with ALS, you can apply for VA service-connected compensation and benefits and register for VA medical care. Please, if you're listening to this presentation and you're a veteran, take advantage of these benefits. They do provide outstanding services, equipment, compensation for our veterans. And again, if there are any veterans listening to this conversation, again, I want to thank you so much for your service. And I'm really happy for all of that you do for our country. So I'm just putting that out there real quick. And definitely take advantage of the benefits that are out there for you. And so there are VA healthcare ALS clinics, and they can attend an ALS clinic, like a regular multidisciplinary clinic, and receive care both inside and outside of the VA healthcare system. So just for you to keep in mind. And you can also register with a VA service organization, such as the Paralyzed Veterans of America, to advocate for you. Great resource. There's the website and the phone number. I don't know if this presentation could be shared afterwards. I'm going to ask and I'm going to let you know. But very, very important information, Sometimes we can get overwhelmed with other things and forget that we can access this type of thing. So that's why I'm putting this sort of checklist together. I want to briefly cover equipment. And it might be a little early for some of you. And also, you may not need all of this equipment. So my idea is not to overwhelm you. I just want you to know the sources and the equipment for when the time comes, if it comes. Okay? So I've sort of broken up the type of equipment by mobility, communication, assistive technology, safety, and respiratory. Some of the common mobility equipment that you may need down the line: walker, transport chairs, wheelchairs, Hoyer lifts, accessible bands for your wheelchair. Again, this is just for you to keep in mind, be prepared, but don't overthink it or panic. Communication is a huge one. Technology these days is amazing, and we really need to take advantage of what's out there. So there's different type of communication devices. There's some very basic boogie boards or alphabet word boards, but then there's also iPads. There's a lot of apps that can do like text to speak type of thing, eye gaze devices, which are fantastic. So all of these like AAC devices, it's a whole world, but it's important for you to know that they're out there. Okay. Assistive technology for activities of daily living. So if you need to button your shirt, if you need to pull your socks, if you need certain type of utensils so that you can use it that don't require such fine motor skills, they're very accessible on Amazon, not expensive. For safety, grab bars, shower chair, bed rail. Respiratory, and you can probably going to hear this from a respiratory therapist, cough assist, the BiPAP machine, Trilogy, suction machine, and nebulizer. And the sources, okay, you mentioned equipment, like where can I get this? Obviously, number one, insurance. Medicare, it's going to be your best friend if you're eligible. Okay, keep that in mind. Again, you're going to be automatically enrolled if you've been putting money into the system, basically. There's also ALS equipment exchange. There's some Facebook groups. That's why having these networks of support are fantastic. Even if you go to, if you virtually attend a support group, you can have this type of equipment exchange. There's obviously Craigslist, eBay, Amazon, retail stores. There's the ALS Florida chapter loan closet. So we do have a loan closet of durable medical equipment, which includes mostly mobility equipment and communication, okay? Anything related to hygiene or respiratory, you're not gonna find it there for obvious hygiene reasons, but you can ask your regional program manager more about the loan closet and see how you can access, a wheelchair if you need it, or a communication device. And these program managers from the ALS Association work hand in hand with the clinic team. So if your physical therapist is recommending a certain type of device or a certain type of equipment, rather, after assessing you, you'll make sure you're going to be sure that you're getting something that's safe for you, and you can, access it through the loan closet, which is, it's great. And there's also different type of grants from different sources. There are many sources. There's different nonprofit organizations, including the ALS Association, that offers this type of grants, case-to-case basis. Also something that you might want to discuss with your local social worker in your clinic. Important. Now, there's two things that it's never too early to start, right? I've been telling you, prepare, but, don't go so far ahead. It may not be relevant to you, but there's two things that are kind of important to start at any stage, right? Even if you've been recently diagnosed. And the first one is stretching. Stretching and range of motion exercises should be started soon after diagnosis as part of a gentle, wellness-oriented daily routine. Performing simple stretching exercises to target the major joints will help prevent painful, function-limiting contractures. So it's something to keep in mind, right? There's physical therapists and occupational therapists that are the experts, and they will develop an appropriate exercise routine for you. Again, in your multidisciplinary clinic, you can have this discussion with them. Now, the program can be performed independently in the early stages of the disease, and you can do it on your own. It's basically being active and doing the basic stretches to make sure that you're preventing some pains, some cramps. It's really helpful. Really, really helpful stuff. So just putting it out there, it's never too early to start stretching. And the second one is voice banking or message banking. For some people, ALS starts there with speaking difficulties. However, it's not the vast majority. down the line, and again, there's no timeline for this, most people at some point experience this difficulty speaking. And this is where technology plays a huge part. So there's these communication devices that I mentioned briefly a little bit ago that are amazing, because you can actually record your voice, save the recording audios to a file, load them into a speech generating device, and then when the device speaks, it will sound like you, right? That's pretty cool. So there's message banking, which is digitally recording personally meaningful voice messages to use for communication or legacy work in the future. So you will do full sentences, whereas voice banking, it's really cool because it'll record a speech sample for future use with a device. And there's a range of softwares and apps and ways of doing it. Some are free, some cost money, and it depends on how much you want to spend or how much you want to be involved with this. For some people are like, I just want the basic, that's fine with me. For some people, it's very important to get their pitch recorded, their laugh, their tonality, everything. Communication, it's a very important aspect of us as human beings. So one way or another, we got to communicate. And I cannot sort of highlight the importance of voice banking. And you can speak with your speech language pathologist at your local or your closest ALS clinic to see what your options are, to discuss softwares. I know there's one, you can go to modeltalker.org, and I'm going to send this link in the chat box, and there's one called siriproc.com, and you'll get some more information on sort of where to start with the voice banking. Again, something for you to keep in mind. It exists, it's out there. Ultimately, you'll make the decision if it's something you would like to do or not. These are all suggestions. Moving on. Make a difference. Get involved. I think that ALS, or people that have a loved one with ALS, or you're experiencing ALS yourself, or for whatever reason you've been in contact with someone that has this disease, you really want to get involved. And that's my case, for instance, right? I worked with the ALS Association for 4 years, and now on a personal level, I'm still involved. I'm still putting my part to fight this fight and to move forward and hopefully see a treatment soon, right? So get involved in whatever level you can, and there's different ways of getting involved. I think I didn't mention this before, but when I was talking about research, and I'm just going to make a little pause right here. When I was talking about research, I forgot to mention how important controls are. Whenever someone is conducting a research, they need a baseline. And for that, they need a control group, which is a person that doesn't have the diagnosis that's being researched. So for clinical trials, control groups are needed. And this is people that don't have the diagnosis and that are going to serve as a baseline to compare. Okay. If you are a loved one that doesn't have ALS and you want to be involved and you want to be part of science and adding to science and adding to research, I encourage you to talk to a center of excellence that's conducting research and see how you can be involved, because chances are you can be part of research without having the diagnosis and really make a meaningful impact in moving forward. Okay. I know, from my personal experience in the University of Miami, they're always looking for controls. You can have that conversation. They'll be happy to talk to you, to accommodate you, to sort of handhold you through the process. And you're going to really, really make a difference. So just keep that in mind. It's super important. It's a way of giving back in a way, Okay, it's really a way of giving back and adding to science. So you don't need to have ALS to be part of research. Just putting that out there. Other ways to get involved. The ALS Association has a variety of events happening. They have their signature walk to Defeat ALS, fantastic event. They usually have like 14 or 15 throughout the state. Again, this year, everything's different. We're all adapting. We're all going virtual. So I do want to let you know that Gainesville, Miami, and Tallahassee, their walks are going to be a walk your way. And what that means is that you pick where you want to do the walk, you pick for how long you want to walk, and you can, put together a team, help with fundraising, spread awareness. That's huge, right? This is not cancer or other diseases that we all have a loved one, relative, friend that has gone through that. There's a lot of awareness, right? ALS is a little more rare. And so it's really up to us to have these conversations, to tell people this exists. This is a disease that's out there. This is how it's impacting my loved one, right? This is what we need to do. So very important part of our walks and our events is that awareness aspect. So I do want to invite you all to be part of the Gainesville, Miami, Tallahassee, which happens to be the college rivals, right? So FSU, UF, put on your shirts and walk your way. It's going to happen on Saturday, November 7th. And there's going to be a live opening ceremony at 10 a.m. You can find more information about this walk online. It's going to be a fantastic event. I know they already had, at the beginning of August, the first trial, the first walk your way, and it went really great. So I'm looking forward to see how this one goes. So, I invite you to take a peek and see what's there and put together a group. There's also the Florida Ride to Defeat ALS. So you can get your family and friends involved. This is going to happen on Saturday, November 21st. You can ride wherever you choose. Again, all the events this year, we need to take care of each other. We have to go virtual. I know Stephanie in the chat box is adding the links, so you can click there and go directly and see how you can be part of these events and fundraise and have fun and spread awareness, test your strength, grab your friends, and really join us. The goal for this year for the ride is $125,000. That's for all teams, not for you as a team. But if you want to raise that yourself, you are more than welcome. But again, wonderful event. I love bike riding. It's going to be amazing. So I'm just providing that information for you to have. And then last but not least, become an ALS advocate. This is so important. Patty Stanko, who I believe is listening to this presentation, I don't know if you can raise your hand virtually, Patty. She's in charge of this. And if you're passionate about telling your story, if you're willing to draw awareness and gather resources and get resources to the people affected by this disease, this is for you. If you want to step outside of your comfort zone to affect real change in the way our government responds to the need of ALS community, this is for you. And your stories are important. Your stories, it's what's gonna fuel this advocacy to move forward, right? So when I spoke about Medicare, there's no longer a 2-year waiting period. There was a couple of years ago. That's thanks to advocacy, right? So if we advocate, we spread awareness, we're sort of telling people, listen, this is important. We need your help. We're in this together. Then we're going to get more funds. And I don't mean we're going to get more funds as the ALS Association. I'm meaning as an ALS community. Funds for research, funds to go through all the trials needed to test medications and drugs and whatnot. And ultimately, that's going to lead to a treatment. So it's all sort of like a chain, right? This is the first step to advocate, to really let people know this is important to let the government authorities know we need your help, and this is why. And that's where your stories come into place. Fueling research, getting funds, because ultimately the money is needed. Research is very expensive. Trials are very expensive. Developing a certain drug and all the FDA approval, it's a whole deal, right? But we need to start somewhere. So I encourage you to get in touch with Patty Stanko. And yes, that's my last slide. And I'm very happy that I got to share this information with you. So that's me being happy. And I do have to say that after the 4 years that I worked closely with ALS patients and their loved ones, I learned an incredible lesson. And it's that a happy person is not a person in a certain set of circumstances, but rather a person with a certain set of attitudes. So with that, I want to open the floor and see if any of you have questions. I'm going to see how I can get to the chat box. So yeah, thank you so much. And if you have any questions, feel free to send a little message and I'll be happy to answer them. Oh yeah, Patty Stanko's awesome. I second that. I know Stephanie shared some resources. Let's see. I'm gonna just really quickly. Okay. Are you still seeing my screen? I don't know. Oh well. No questions so far? All good? All right. Thanks, Lourdes. Good seeing you virtually. I hope this information was useful, y'all. It's like I said, a little bit of a checklist and just things to keep in mind and to be prepared and have those conversations with your social workers, your therapists, and make informed decisions. It's very important to be informed. So thank you so much, and I hope you enjoy the rest of your day listening to amazing presentations, getting all that knowledge, and know that you're not alone, that you have so much support. So know that. It's just from the bottom of my heart, I know that people at the ALS Association are fantastic and always willing to help. Okay.
Oh, here, Camila, a question just came in. I don't know if you can see it. It says, where do I find resources for equipment that a patient needs, such as spoon, toothbrush, etc.?
Right. So resources for people that have some challenges with fine motor skills. It depends. So I would say definitely talk to your occupational therapist, but you can find them anywhere. So in Amazon, if you search, there's a bunch of sort of chunky utensils and toothbrush, and I can add, I don't know, can I add the links here? Can I or after the presentation, Melissa, so I can direct them directly to there? Can you hear me? Uh-oh, I lost you. So
we should be able to come back.
I want to be able to send her a link, him or her a link, directly. I don't know what to do. I don't know if I can do it after the presentation.
Yes, or we can copy and paste it directly into the chat box.
Okay, is the chat box going to be on for a little bit longer?
It will end when we end, but you can also reach out in the care services box. We can get it through the expo booth under care services.
Okay, I'll make sure to, I just don't have it handy right now, but I have a good sort of PDF with all the things available for people that have challenges with fine motor skills. So I don't have it handy, but I want to make sure to share it. And again, it's something that you can talk with your occupational therapist, or if you can even Google fine motor skills, activities of daily living solutions, and a bunch of things are gonna pop up. There's even some tricks like how to use a scrunchie to get a pen to stay in place and whatnot. So I wanna share that information. I'm gonna do it later. But there's definitely a lot out there, and it's very inexpensive. In Amazon, you can get some of these utensils for $12. Oh, Haran's saying there's an occupational therapist in the learning lab. Awesome, awesome, awesome. So about the deep tissue massage, it really depends on what stage of the disease you are, and it's very case by case. I'm not a physician, and I'm not someone who is gonna best answer or address that question. I know there's a point where that type of massage is sort of counterproductive or beneficial. So question for your physical therapist or neurologist for sure. They'll know you better after assessing you to see if it's still a good option for you at this point, Robert. I'm not sure if we need to discuss different therapists. I'm looking at Karen's question. My twin sister, I'm not sure if we need to discuss a different therapist or request someone that has more training. So ideally, if you have someone local that has experience with ALS patients, that really is ideal. You want someone that's trained and that can provide the best care. Parkinson's, it's a movement disorder, but it's a little bit different from obviously from ALS. Patients can have some common symptoms like the rigidity in the muscles and whatnot. But again, if you have a local clinic, you can ask them and they can refer you to someone that has experience with this particular disease, which would be ideal, right? So yeah, it's a good idea to request someone that has more training and experience with ALS. I want to introduce Hillman. Oh, good point. The large handle utensils tend to be very heavy. I've heard different things. Some people find them very useful. For some, they've also pointed that out that they can be a little bit heavy. It depends on the material. There's a wide variety of material, and I guess, I don't know, it doesn't hurt to try them out. Like I said, they're not that expensive. I think they start at like $9 or something. And yeah, I mean, it could be very possible that, let's say, pipe insulation from Lowe's. Oh, thank you for sharing that, Cindy. Yeah, absolutely. You can make your own utensils. Look at that. That's great. Thank you so much for sharing that. And there's even, I don't know how you call those noodles for the pool. You can use them as well for, to adapt certain things so that you don't have to use your fine motor skills, but rather like larger grip. So you can definitely get creative. And that's also a beautiful thing from the support groups, that you get to share that. People get very, very creative to find solutions. And that's something that you're not going to find most likely from a doctor or from a physical therapist per se, but from people that are in your same situation and have had the need to get creative, and it can be something that can help you out as well. So yeah, noodles for the larger items. Yes, that's a good hack. I don't know if anyone else has any other questions or comments or want to share what worked for them. Cindy, I appreciate you sharing that. Okay. I think we're done. All right, everyone. Have a great day. And thank you again for having me. Bye.